the slides? Okay.
It's the notes one though, so I don't know if you want to do the,
Um,
Slideshow one.
yeah.
yeah, I can. Um, then I just might have to stop sharing so that I can.
No, hit from beginning, see what happens.
Sorry. Yeah, it's not,
You see on the left, you have from the beginning, try and from there. Yep. There you go.
okay,
There you go.
perfect. Okay, sorry. So today we're gonna really be focusing on the sevens, and then we have just one slide to share kind of the connection between performance indicators and accreditation. And then we have just a few updates that we have made and will be making to SharePoint. And again, you know, so we'll record this session and it'll be uploaded to the HFNY website. We'll leave time for questions as always at the end. And if you have questions as we're going along, please type them in the chat and we'll make sure to get to them at the end of our session. So for the agenda today, like I said, it'll be all the BPSs for your self-study for BPS 7. Performance indicators, like how they connect to accreditation. We're going to share the boilerplate language for GA 5B. That'll also be uploaded to the website, and we'll send that to programs. And then just the SharePoint updates. So we'll go into detail when we get to that slide, and then questions. So we have a shorter agenda today. So we'll leave lots of time for questions if you all have questions, and they don't have to be just on BPS 7. It can be, you know, anything related to self-studies and accreditation. So just an update on the accreditation timeline. So we're here in October, and this is session number 9. We have yet to determine what the November topic will be, but we're sort of thinking that it'll probably be focusing on SharePoint and uploading all things for the self-study. So BPS 7s. So there are 4 policies that will be uploaded into your SharePoint under the policy folder. Those are the medical health care provider, immunizations, referrals and linkages to healthcare and community resources, and depression screening. And you know, policy 7 drafts went out for feedback. They're not yet finalized, and so obviously once those are reviewed by your OCFS program contract manager, that's when you would want to upload those into SharePoint. There are also several reports that will be uploaded to SharePoint, and so those are 7.1b, 7.2b, 7.2c, 7.4b, 7.4c, and 7.4d. And we'll talk about this a little bit more, but Central Administration is working on a spreadsheet that will list out all the reports required for your self-studies with the dates that you'll need to run for each report according to your contract start dates. And we'll be sending this out to programs the first week of December. So please, just as a reminder, don't upload your reports yet into SharePoint. You're going to want to wait until after 12/10 to upload those reports so that you can ensure you have the most updated, most recent data. And then there is just one piece of narrative that's required for your self-study. related to BPS 7, but this narrative is captured in both your ASR, and then there's additional information that may be captured in your quarterly report. So if you upload your ASR and your quarterly reports into SharePoint into the related folders, you'll be providing everything you need to for that narrative. And so, again, just to show you, this is where HFA asks for narrative specific to focused children with well childcare. And so we have, I just took a snippet from the ASR, which is here, just asking to provide narrative on how the program monitors well childcare visits. And then any strategies developed, and then any information on implementing those. So that like latter information may be more in your quarterly reports, which is what we ask. And this is a snippet from the quarterly reports on that same information. So again, if you're uploading both of these things into SharePoint, you'll be covered for that. And then, so we just wanted to share a little around the connection with performance indicators and how it connects to accreditation. And so, really the PIs, it can be a great way of making sure your program adheres to HFA's BPSs. There's still time for you to make sure data is entered into MIS to meet your PIs. And so when running PIs as of 10/11/23, please make sure to use the correct PI detail document. I can make a note. I know Allison just sent that out recently, but I also can just attach that when I sent a follow-up email.
Melanie, the problem was that we found some inconsistency. So after Allison's email, I sent an email with the corrected version of the timeframe, especially for the retention PI. So please make sure that you use the one that I sent. I know that there is an additional error that Sophia yesterday mentioned, that for the report used in PI number 3, it still says accreditation, and you might remember that we changed that to be called or be under the analysis group, because it's not following accreditation standards. It's more like the way that we do it in New York. So that is the only error that is still there. It says accreditation under the report, but the report is under the analysis list.
Okay.
I think you still can find it by 2-1.
Okay. Thank you.
You're welcome.
So I'll make sure that when I send out the slides and the boilerplate language, and I'll attach the most updated PI detail.
Yes. Yes. Go ahead.
Okay. And so the performance targets in PI number 1, so, like the immunizations, medical provider, well baby visits, ASQs, and referrals for the big 3 are all BPSs that will be scored by HFA. Same with the items such as retention, timing of the first home visit rate, or case weights. And trainings are another example of how the PIs can help you make sure you will have all that is needed for accreditation. Even if PI reports are not required by HFA, running them in the MIS will help you to write your narratives. And so again, there's nothing like specific that you need to upload, related to the performance indicators, like, what we'll send out to you when we run those. But we just wanted to kind of just include a slide just to help programs to kind of see the connection on how the PIs can help you in preparing for accreditation and ensuring that you're meeting all of the standards. And so here is the boilerplate language that we created for GA 5B. And so this is what you'll upload into SharePoint. We do have to make a separate folder in SharePoint for you to upload this to. Currently, there isn't a place designated for this. But this is just around notifying program manager or supervisor, I'm sorry, OCFS program contract managers, when there's a participant death, or death of another household member, living with the family. And so this is just the boilerplate language that you'll upload, and you'll just complete, you know, healthy families. You'll put your program name here, stating that you follow HFNY policy and site-specific procedures pertaining to GA 5A, the reporting of participant deaths. And then you'll healthy families, again, you'll put your program name, and you'll indicate the number of deaths that occurred in the current year. And then if there were deaths, then you're going to complete this chart accordingly. And if there were no participant deaths, you'd put a 0 here, and then you just mark an X here. Oh, skipped a slide. So now, I'm gonna show you, we'll go into the SharePoint site. But we made a couple additions, and I'll show you those. The subfolders have been added to the personnel folder to help keep the information a little bit more visible and organized. And so I'll show you those. We do apologize that we did not have this done sooner. So those programs that have already uploaded, if you wouldn't mind kind of just moving those into the appropriate subfolders, that would just be really helpful for when peer reviewers are here, and for us when we kind of do a preliminary review to kind of ensure everything that needs to be in the self-study is in there. And then we haven't done this yet, but we will be working to add subfolders to the folder that's labeled additional reports. And like I said, adding a folder for GA 5B. And our goal is to obviously have those subfolders in the additional reports folder completed prior to you know, when programs will start uploading their reports. And so I'm going to I have to stop sharing for a second to be able to then go to sorry, SharePoint. Oh, give me 1 minute, and I'm going to share my screen so you all can see SharePoint.
Yes.
Okay. So if it's okay, I'm just gonna go into Albany, just to go to the personnel folder. And so this is what we've done. We've added subfolders for each of the personnel requirements for the self-study. So just 91A through 91D, and then 92. And then, as we said, in the additional reports folder, we're going to be adding subfolders so that it's just really easy to tell what report goes where, in which folder. And then I apologize because I jumped ahead. We wanted to give you a little sneak peek of the Excel sheet, which is not done yet, but we wanted to just give you a little sneak peek of that. And so I'm going to do that now. I apologize, Karina. I jumped ahead.
Oh, that's okay. I was going to show everybody what it looks like. So if you want, I can share and show. Okay.
Perfect.
Okay. So I have two spreadsheets that I want to share. The first one was because I want to answer and make sure that everybody understands the the question that Emily put there. So on the HFNY tool, that the accreditation tool, you have in each one of the BPSs, according to what HFA is requesting, whenever it says on their table of documentation that a report has to be added, then you would be running the reports and adding it, as I said, after the 10th of December to give you all the month of November and up to the 10th of December to enter the data and have the most recent data available. And that is why I indicated here, I highlighted those reports that are being used in the PIs, because as I was saying, you know, like it's good to have the PIs as a way of making sure that if you are adhering and you are meeting right now, most likely by the time we get to sending the reports to HFA, everybody will be fine. We in New York State sometimes ask for even a little bit more than what HFA requires. That is why you have to follow the list of reports that you are going to be sent. So let me give you a sneak peek of what this is going to look like. We haven't totally finalized it. Do you see now the report date calculator? So basically, we will be able to send each one according to how these reports, you know, the end of the start of your contract year, and how the different dates you will be running each one of the reports that you have to add according to that table of documentation. So you will have the list, you know, how the MIS has some reports that have a default date, but the table of documentation for HFA asks for a different time frame. So they might be asking for the last quarter, or for the last year, or for the last, you know, like, so it depends on what HFA is asking for. And that is why we are working on this kind of tool in order to be able to help you make sure that you're going to have the accurate date. And Trina, we want to make sure that you have all the date possible and that you have time to make sure that you enter everything into the MIS so that we collect the most recent and accurate data. That is why we've decided that 11/30 is going to be a cutout date. We're going to be then measuring whether it's the last quarter, is the last year, or whatever, but we have to give you time to enter that data into the MIS. So that's why we're asking, do not upload any reports to the SharePoint right now. We're going to wait until the first week of December, sorry, excuse me, for us to share exactly. If you are a July contract, you have to run the reports using these dates. If you're an October contract, you're going to be using these other dates. So that is our way of helping you make sure that you have the, you know, the correct timeframes for each one of the reports that you will need to upload into the SharePoint, but do not do that until after December 10th. So you have all the data secured until 11/30. Okay?
And I'll just add, so you shouldn't and don't upload the reports. However, I know some of you have started uploading finalized policies, which is great. your personnel. So again, there were a few, when I had gone into each of the folders, there were a few people that did start to update personnel, or to add that to, which is wonderful. And then I went and added folders. So I apologize for those few programs that did go in. But we had gotten a question from a program about organizing those personnel things. And so it did make sense to divide them up a little bit so that we know, and, you know, the peer reviewer knows, am I looking at supervisor information? Am I looking at direct service staff? Like, it just makes it a little bit clearer if we divide it up into those standards in that personnel folder. And so look at the accreditation tool, or in the back of each of the sections, there's the tables of documentation, which is what we pulled together in the accreditation tool. And that will help you determine for the self-study, you know, those two things, what you need to put into the folders. So, you know, for the personnel, if you look at the section 9, you'll be able to see, okay, you know, the interview questions, your job posting. So you could take a look at that to see what you can do. The ASR, if you upload that, that takes that takes up a lot of the narratives that are required for certain sections of the best practice standards. So the accreditation tool will tell you the ASR covers these things. If you're answering those questions in the ASR and making sure that you're including all of that information. And so you can start uploading some things, just not those MIS reports, because we'll need to show more recent practice, which is why we're waiting until December to do that.
And that is why it's so important in the connection with the PIs, because as I said, during the PIs, we ask you for a lot, right? And this is the time, if you're not meeting a PI, to see, okay, I still have time to make things so that when you run the data in December, you might, you know, be recent practice showing that you are meeting now. So that's why it's important. We wanted to make sure that everybody understands this connection with the PIs and why we're sometimes a bit more strict, like 100% of family goals. You won't have to send that report to HFA or add it to your self-study, but it's important for you to run this and see, like, okay, this family isn't meeting. Why? What can I do to fix this? Is there anything that I can do to fix it? And you have time now until November 30th, and maybe when HFA comes, you might not have every family with a family goal plan, but you have an explanation of why that particular family doesn't have one, in the sense that, oh, I didn't meet, you know, I'm at 92%. So that means that a couple of families do not have them. Why? You are not caught without an answer when they come. You can explain why it is. So that's why it's important for the PIs to be run, and for you to look at whatever results we have and make sure that you can have all your ducks in the row by the time, you know, accreditation comes.
Hi, this is Carol
Yes.
Peeling. I apologize. I was late because I had another meeting, but I did want to get on to the meeting here today. So I already started uploading some reports and some both quarterly and MIS reports in the July contract. So should I like remove those all? It sounds like, because I wasn't supposed to
So Carol, we're talking about waiting to upload MIS reports. So quarterly reports is fine to upload. We're just really talking about waiting to upload any of the MIS reports. So if you look at the tables of documentation and you see reports that need to be uploaded, we're talking about the MIS reports, not the quarterly reports or the annual service report.
Okay, I did upload some MIS reports, so I will remove those as soon as I can.
Carol, I think it would be a good idea because you might, as I said, you will have more recent practice by December than what you have just now. If you're a July contract, you sent your quarterly report in August. Well, a lot of things might happen from August to December. So I would say keep your quarterly report. That was what you were supposed to, and data had to be sent then. But now for those, following the tables of documentation, anything that says report must be submitted, that is the list that we are going to try and get as much data as possible in before accreditation.
Okay,
And
thank you.
Trina has a question. So the narrative reports are okay. So your quarterly narrative reports, just not MIS, because again, it's going to show something that might not be most up to date, and it could be confusing on, what people are looking at. So save those for the end. Trina, you had a question?
Yeah, I'm not sure if I'm looking at what I think I am. So when it says the quarterly reports for the most recent quarters, is the first line for July contracts or no?
Yes.
Because that does include the second quarter of this year, which would be through December 31st.
No,
Right. Oh,
but we said, if you look, can I share?
yes.
Yeah, let me stop
So,
sharing.
so what we said, we're working on this, Trina, so we might have a few changes. But for example, if you're a July contract and for accreditation, we want the most recent, finished, good. We're not going to ask you to send a report where you still have a month of data that you won't be getting. So you would be using, in that case, the 7/1 to 9/30. That's why each one of you will have a different one. We're going to use, if it's a whole year, 11/30 is going to be the end date, because then you'll have the most amount of data. But this is what we're working on. So
Oh,
hold on.
I'm sorry. I'm referring to the quarterly
Quarterly
report.
reports.
Oh, no. I'm not talking about quarterly reports. You've already sent the quarterly report in, and that is fine, Trina.
Yeah,
But-
she's saying, she's saying, so let me go back to the slide. 1 second. So Trina, you're asking about right here, second quarter for the July contract.
Right.
Programs that have a July contract start date. You're saying that this second quarter of the 23-24 year is going to be the end of December, right?
Right.
That's what you're saying. And so I think maybe we just need to because
I think we calculated that wrong, Trina, because
Yeah.
I'm thinking, yep, the end of December, but actually it wouldn't be due till the end of January.
Right.
30 days
Right.
after the end of the
Right. That's
quarter.
what I was.
Yes.
So it wouldn't be the quarterly report for the second quarter, it would just be the first quarter.
Right. Of
Right, so
2024. Mhm.
Yeah. So I'll edit this slide before I send it out to all of you and before it gets uploaded. I'll also add here just so that it's helpful for folks I'll add here, refrain until, start uploading after December 10th.
Thank you.
Sure.
So, can I have another question then? For some reason, I thought that we were going to try to do our best to get all the data in early. Okay, so I'm a July contract, and then so for the second quarter for me, it ends December 30th, and I thought we were to try to get everything in and the report done by January 5th, but that's not correct.
No, because you would never, that doesn't even give your staff the time to enter
know.
the information. Yeah. So what we're creating is the 11/30 is the cutoff. So that way
Okay.
it gives everybody time to get it in for December 10th. Right.
Okay.
And then that gives you right. So then you can run your reports before because you technically the self-study is due the January 5th timeline, right? So that'll give you a chance to make sure the data's in, run it. Like, okay, do I need to do anything before I finalize those reports and get them in there for that, before that January 5th deadline?
Okay, that sounds great.
So I'm sorry, so will that mean that that last quarterly report won't necessarily be a full quarter? It'll just be those 2 months?
No. So you mean
So
for
I'm in July as well, so the last,
So
Yeah.
you
it
would-
will be 3, 4, 1, and 2, and 2 will end at the end of December.
Yeah.
So is that what you're saying? You're editing the?
yeah,
Yeah,
we're
but
gonna
you
take
won't-
that off.
yeah,
Yeah,
Yeah.
we're gonna take that off and not have you do that second quarter. We're gonna edit that slide for the July contracts because it doesn't make sense. You wouldn't be able to do it. So that was an error on our part, thinking the quarter ended December, but then that doesn't give you any time to get the information actually in and report on it. So that was our error. So we're gonna back it up a little bit and say quarter 1 will be the cutoff for you.
Okay, so if I've already uploaded.
For the
quar-
narratives, just the narrative report, right? So the MIS reports, the end date, because you have to show more recent practice. So the end date, so it's 2 separate things. Your quarterly narrative reports, like you're going to do that like you do that anyway. It's just you'll stop uploading for those for July as of that quarter 1. Your MIS reports, you're going to get that spreadsheet. You're going to put your contract number in or your contract period, and it's going to give you all of the dates that you need to run. But everybody will have a cutoff regardless of 11:30.
Hi, this is Markia. I just have a question again surrounding the quarters. So for the contracts ending in July, because I mean, starting in July, that's
Mhm.
me. So we will be uploading, so we have to upload the last 4 quarters. So we'll be uploading 10/1/22 to 12/31/22. That's quarter 2.
Mhm.
And then we'll be uploading 1/1/23 to 3/31/23. Then we'll be uploading 4/1 to 6/30/23, and then 7/1 to 9/30. Those are the 4 quarters that the July contracts will have to upload. Okay, I just want to make sure that those are the correct ones because
Correct.
you guys are saying all the other stuff and I just need
Yes.
straight answers. So that would be that.
Correct.
And then the additional reports is something totally different from the quarters. And
Correct.
we will have to run those reports as of 11:30 to upload. That's all I want to
Correct.
know. Okay.
Correct.
All right. And then I have
Yes.
one more question and then I will not speak again.
You can speak as
No,
much
no,
as
no,
you
I'm good.
want.
I'm good. So then in regards to the personnel files.
Yeah.
So in regards to supervisors and program managers who have been promoted,
Yep.
do I still upload those resumes into their folders? So like the current PM, would I put my resume in the PM because
Yes.
so those people still have to go in.
Yes.
Okay.
Yeah,
I'm just-
whoever, so think about it this way, right? Because it talks about whoever was hired. So if you had a position prior, right, like, okay, that's fine. But if you've been promoted, you're going to want to upload, right? You're in a new role, you have an updated resume, there's updated, right? So you're considered like that new, you took on that new role. So yes, you want to upload even if you were here last time, now you have a different role. So you want to upload all of the new information for that role that you're in now. So whether it's, I'm a program manager now, I'm a supervisor now. Yep. You'll want to upload the new stuff that you were hired off of since the last accreditation.
Okay, yeah, just making sure. I mean, I did
Yes.
that, but I just wanted to make sure I didn't have to go
Yes.
back.
No,
and
that's
take
perfect.
that out of my folders. Okay.
Nope. Yep.
All right.
Perfect.
I'm all set. Thank you.
And so staff that have left, if you don't have staff that are if staff are no longer there, no, you don't need to put, it's only current staff. Like you're only uploading information for whoever's at your program now. Unless it says like, if this is a reaccreditation, right, for staff that are hired since the last accreditation currently. So they still have to be in the role. We're not uploading people that were here, now they left. Like, nope, it's just whoever's in your program right now.
Okay, so people who are hired within the accreditation period and they're not here anymore, those resumes don't need to be in there. Just
No, if they're
people
no
who are,
longer working there, no. Don't
so
put
just
their
people who
resumes.
are currently here.
Correct,
Okay,
correct.
thank you for that too.
Yes.
Looking at the chat to see.
I would not upload your MIS reports with the quarterly reports, just do the narratives. It's going to get super confusing with the reports, like for the purposes of the just the narratives. Because what we're looking for in the narrative reports are to meet those sections of the best practice standards that speak to narrative, right? The data reports are going to go in a separate folder. So you don't need to, in the quarterly report section of the self-study, you're not doing the narrative report and the MIS reports. It's just the narrative, because the narrative speaks to those sections that ask for a narrative. And then
So-
your separate folder will be the MIS reports.
So Allison, just to clarify, the data reports that go along with your quarterly reports that are uploaded as part of like CMS, we don't want the data reports in SharePoint, just the
No,
quarterly
just
report
the quarterly
narrative.
narrative reports, because we're using the quarterly reports to meet the requirements of the narratives that are in the MIS, or, oh my God, that are in the self-study.
Right.
Nora, you have your hand up.
Yes, thank you. I had a quick question about the ASR. So we had our site visit back in July and I got our feedback about our ASR. Did you want us to, based off of the feedback we receive, revise our ASR and sort of improve in specific areas and then re-upload our ASR?
Into the SharePoint, yeah, I think if you got feedback that there's things missing, that you should add additional things, right? Because that's what's going to go in there to be scored against, right? So if you're missing information or there's additional things that need to be added, yeah, before it goes into the self-study, I would do that to make sure you're covering all of those areas that are needed to meet that specific standard. Or that narrative, right? So yeah.
Thank you.
I have a question. We ended up having to do a PIP based on our site visit. Does the PIP go in as well?
No, because you're not putting your site visit reports or anything. That's stuff that we're doing for central administration. We have to submit the site visits of the feedback we're giving to you. So you're not putting your site visit reports or PIPs into the self-study.
Okay, thank you.
What else?
Well, good morning, everyone. I have a question on the policy 7 that the form that you showed us. It's only for enrolled participants who may have lost someone in the family, right? Not someone who was just screened and then we ended up losing someone during that process.
I will double check on that. Let me ask HFA if you should include, because they weren't enrolled in the program, they were just screened, lost someone, and then didn't enroll.
Right.
I'll double check. That's a good question, Jamie. Did you fill out a critical incident report for that?
I did.
Yeah. So that's, yeah.
I believe I did. I can't remember, but I know I just let you guys know.
I'll double check. That's a good question. I don't want to say no. And then there's a critical incident report on it and we didn't, so I'll double check with our TA person.
Okay, thank you.
So I just wanted to recap a couple things, right? So we will update that slide because we did make that error with that Q2 for July. So we apologize for that. The narrative report we'll only ask you to go through 9/30 for that one, not that December date. Because that's not helpful. So for, as Markia said, the July contracts will update those quarterly reports for the last completed 4 quarters. And so just so you know, it'll be Q1 that you'll end with on the narrative reports that you'll upload into the folder that says quarterly report. So we'll update that slide to make sure that's clear. When we're referring to reports, it's you'll get that Excel spreadsheet that we're going to send out so that you can put your contract dates in, that you'll know timeframes that you should be running things. However, the end date is not going to correspond with everyone's contract. It's going to be 11/30 so that we can show most recent practice in those data reports. And that's just for the MIS, which will go into that folder that says other reports. And we're going to create subfolders so it's really clear on where you need to upload each of those reports that you're going to be running to show that either past year, most recent practice. So we'll work on the subfolders for the other report section. Again, you will get that spreadsheet so you'll know the time frames. For the narrative reports, you don't need to also upload MIS reports into that folder because, again, the purpose really was so that you weren't writing quarterly narrative reports and then having to write separate narrative reports for the self-study. We specifically set up the quarterly report so that it is addressing specific narratives in the documentation request. So we're using that to show, like, here's your narrative about this. This is how you monitor that, and write that narrative quarterly to us. So just narrative reports go into the quarterly report folder. Okay. And then MIS reports, totally different. That's going to go into the other reporting. You're not doing anything with that until we get to December, because that's when we have to show like the most recent practice before your self-study is due January 5th. And then personnel, it's only current staff. If you've been promoted or a staff person has been promoted since the last accreditation cycle, you're going to want to put their most recent hiring information in there. Even if they were at, during accreditation, they were the FSS, but since that, they've been into the supervisor role. You're going to want to make sure that all of that new information, because it's, it's kind of like a new hire. They're taking on this new role. They have a new resume. They did an interview, right? So it's a new process. You're going to upload all of their information into there under whatever that new role is. Staff that are no longer with you, their information does not need to go into the personnel. It's only whoever's still employed with you. So you don't have to worry about doing every person, that has ever applied or been in the position or, been in a position. Only current staff for that. And then I will follow up with HFA about that enrollment question, or take a little deeper look in the standards to see what it says, but I'll definitely clarify with them to make sure when we're writing out that narrative and the chart to talk about participants that have had a death, that it is just for those that are enrolled that have been enrolled in the last year, not necessarily somebody who just did a screen. So I'll follow up and then we can send an email out about that.
I see Esther has her hand up. Allison.
Sure, Esther.
Hey, yes, so I wanna just clarify really quick. Do we have to, for the sites, for those of us that acquire new sites, we're not going to be including those reports and those records for our new sites because we're under the 2-year mark, right? So are we, and they're not part of the accreditation process at this point, that's what I'm saying. So are we also teasing out that data out of those MIS reports, and are we teasing out the staff out of those for the personnel tab?
I think it's going to depend on how your site is set up. Like if you're considered an expansion and considered one program, or you're considered 2. So let me check to see what what we're gonna do about that.
Right. Right, because I have two contracts, one Clinton Franklin, one SS.
Yeah, it's
Hamilton
two
and Warren.
contracts, but it's considered one program, like
One
you were
program.
considered an expansion, and I'm not sure
Right.
that they give the 2 years for an expansion or just if you're a brand new site.
I see, okay, because it makes a difference on the recent hire part for the personnel, right? And also makes a difference on the whole total of the data, so
Yeah.
just wanted to make sure
Yeah,
we're clear on that. Thank you.
what
Does
else?
anyone have any other questions?
I have to jump off for another call, but I think we just had the one thing around
Yep.
the policy that you just wanted to ask. Okay.
Yeah.
If you do have questions, feel free to call or reach out to us or your cohort person, but Melanie just has one other thing. Have a good day.
Thanks, Allison.
Hi, Allison.
So we just actually had a question around we wanted to just it's coming from our policy committee, and we wanted to just gather any feedback from you all around the 7-4 our current 7-4 policy and then encourage you all to include feedback in the 7-4 draft. So in our current 7-4 policy, right, we have in there that in instances where the depression screening is done as part of a collaborative process with other service providers involved with the family, the site must be in receipt of a copy to show that the screen was completed on time and to make and track any necessary follow-up, referrals, or interventions for the family. And so we wanted to just ask those of you that are with us here on the call today, is this happening for any of your at any of your sites? And if so, what that process looks like when it does happen. We just wanted to kind of gather that feedback, if any, and share with our policy committee, which we have later this afternoon. So I guess first I'll just ask, like, are there any programs where this is happening, where the PHQ-9 was administered with a service provider that the family is already involved with? Is that happening for any of the programs here?
Yes, for us, we have to, when we have families that are part of BHSN, our lead agency, and they do the PHQ-9 along with other forms, and we can pull that information from the avatar system, you know, and then we also have to report our own PHQ-9s into the same avatar system for that family. So it has to do something with billing for BHSN. I'm not sure exactly why, but we can use that.
So if you use their, right, that one that was previously administered, then you don't do one within your program, or you also do?
No, we also do. We also
Okay.
do. And what we do is basically we pull the previous one or the original or the first one or most recent, whatever is the case, to see where we're standing on the answers and to kind of have some talking points to if there is any improvement on the scores or not improvement, you know, and then go from there for the referral to then talk to the counselor that is in charge with this family or with this particular client. But we still follow our own HFNY protocol. And the one thing that is happening is that BHSN is using us having those additional PHQ-9s as I don't know, something for the outcomes that counts for their billing. So we're doing it more often. So we're helping the entire overall of the agency. That's what we're doing.
Thanks, Esther. Anyone else? Are any of the other sites using PHQ-9s that were administered from a not administered within your program, but previously with a service provider the family is involved in or with, I'm sorry. Okay. Roxanne just shared you don't have access until you do your own. Okay.
Good feedback, thank you.
Thank you. So there were just a few more slides, which I don't really think that we need to go back, but I could just so again, if you have additional questions, you can send those you know, to Allison, Suzanne, or I, or in meeting with your office hour accreditation office hours assigned PCM. For those of you that have questions related to setting up your Outlook account, I think at this point everyone is good with that. But if you do have questions, reach out to Claudia. Any questions related to interfacing with SharePoint, so uploading, you know, what folder should go, what should go in which folder, you can reach out to your accreditation OCFS program manager. And so I'm gonna stop sharing.
I am going to, the last thing, I'm sending the most recent and corrected PI details document so that you have it here, and then we can put it up on the, so if you can just click and download onto each one of your computers, you make sure that you have the one that says analysis instead of accreditation.
Perfect, thank you.
Are you okay with me stopping the recording?
Yeah, yeah, I don't think we have any other questions.
So I have a question about DPS 7. So regarding the target child's medical well visits and immunizations, I'm not sure, like, if you happen to know in the HFA BPS if there's any distinction between children that were enrolled with child welfare protocols. So, like, for example, one of the targets is the immunizations, the 6-month immunizations. But if we don't enroll the child until they're like 1.5, you know, they show up in there, but, you know, there's nothing that we are able to do to kind of support the family and being on time with that.
Emily, are you sure they're showing up on there?
I'm
Because
not just talking on the
because
report itself.
We worked the report so that they wouldn't.
Okay.
So basically, for things like cheers check-in or
Okay.
immunizations, if this is a child that you are receiving older than that, the report is not including them.
Okay, so then for accreditation too, it won't be counted in that.
It won't.
Okay. I think my quarterly, the quarterly performance targets are showing up with one of those families, but I'll run it and put in a ticket if it's a problem.
If you can let us know, because I know that when those reports were put up, we took into consideration that thing, but it could be that the child entered, 6 months and 1 day. And so it's now showing if it had been entered, 6 minus 2 days, it would not show up. So, like we can look into that.
Okay, thanks.
Does anyone have any other questions?
It was kind of strange that Emily wouldn't ask questions. I was like, what's up with Emily?
Well, good, then you all and we all can have an hour. Oh,
I have one.
okay.
It's been, and maybe I just caught part of the comment that Allison said. I know there's a lot of narratives where we're peeling off a paragraph here and a sentence there out of the ASR, but there was a comment about not uploading the ASR, and I thought that was something we had to do anyway.
No, you do have to upload the ASR. So, I'm not sure though, Kira, can you share what you mean about peeling narratives out of an ASR?
I understand from the different accreditation meetings we've had, and I know there's a lot of changes after we have this and updates and all of that, and it's confusing to me, but there are certain narratives that you pull from the ASR because certain things are answered in the ASR. So my question is, we pull those pieces out to answer those questions and uploading into their particular folder. And
No.
then we hand in the ASR. Help me out.
No. You're just gonna upload your ASR.
Okay.
A part of the way that we designed the ASR is to include everything that that HFA is asking for in terms of narrative. So if you look at the tables of documentation in your BPS manual, all of the places for all of the standards that ask for narrative, we included in the ASR, except for GA5B. That was the only one that we did not. And that was an error on my part because I missed that. But that's where we've just provided, we're going to send you that boilerplate language. But no, you shouldn't be copying or copying narratives and pulling them from your ASR to upload them into a folder in SharePoint. You upload your ASR, all of those narratives will be there. All of the narratives that are required per HFA are going to be in your self-study in your ASR. Does that make sense for everyone?
Yeah, it's a little late because I already uploaded all of my BPS 1 narratives.
Was that shared like I'm just wondering where that kind of misdirection came from. If you have like, was that?
No, this is from our previous experiences where we had to do this we had to do a folder for each best practice standard. And so we would put the evidence for each standard in that folder. So we were going by previous experience and practice.
So the last accreditation cycle, is that what you mean?
Right.
Oh, okay.
Yes, I agree totally.
Yeah, so our apologies that happened for some of you, but no, that's part of what we did when we created the ASR, is to say like all of the narrative that's required per the tables of documentation will be in the ASR. You don't have to pull it out. Okay,
maybe we didn't participate in the last accreditation cycle. We were brand new in 2020. 2017, 18. So we missed all that, but maybe it's just discussion. And I know from different accreditation meetings that I've attended, and I haven't been able to get all of them. I know that there was some comments made about pulling stuff. Oh, that's in your ASR, that's in your ASR. But okay, you've clarified it for me today. Thank you.
You're welcome. Yeah, just upload your ASR. Now, like Allison had shared, the other piece is you should be uploading your ASR after it's been reviewed by your OCFS program manager, right? Because they're going to be giving you feedback. Once that's submitted, they'll review and they're going to give you feedback. So what they're doing also as part of their review is making sure that all of the required information per HFA and their requirements are included in your narratives in your ASR. And if they're not, they're going to give you that feedback to say, you know, this information is missing. And so like Nora's question, you're gonna want to, based on, right, it depends. If it's something that's required by HFA to be in that narrative and it's not in there, then that's the time where you're gonna want to make edits to your ASR before you upload into SharePoint.
Okay, our ASR is December 1st through November 30th. So I have until the end of the month in December to finish it. So I'm going to be looking at 2022 to 2023 ASR. So the time span of me getting it in within that December 30 days, getting it done and getting, you know, and I know we're running right into Christmas holiday and people have off. My curiosity is, will I get it back by this January 5th deadline? Or am I counting last year's ASR?
No, you're going to do this year's ASR. And so you're right, that is a crunch. So those programs that have their ASR due December 31st, you can work to try to get it in sooner. Then you don't have to wait until the 31st. But yeah, those will be working with our staff to help and provide the support that we can to say, you know, to remind them and let them know those should be priorities once that ASR is submitted, to get that reviewed and back to programs prior to that January 5th so that it can be uploaded. And so it is a crunch time. And so very important for programs to get that in by that deadline.
Yeah, I know our quarterly is due on the 15th and the ASR is due on the 31st.
And so Sarah, yeah, sorry, we will be emailing the GA 5B boilerplate language, and then we'll also upload it onto the website.
No, I just have one quick question, just so I'm not confused. We have to upload the ASR, and we're uploading all the best practice standards as well. And then we also have to upload the GA5B separately from everything else.
So let me share my screen. So I'm gonna, let's take another look at
PowerPoint.
I might be the only one that's confused.
Yeah,
I don't want to hold anybody's time up. I might just be the only one, so.
It's okay. I mean, it's okay. This is the place to ask the questions if you are confused or want clarity. So it's fine. Give me just 1 second because I want to just pull up SharePoint to show you. So just 1 minute. I'm going to share my screen. Oh, sorry. My second computer screen here is now wants to. Sorry. Okay, here we go. So let me just share. So you all can see SharePoint?
Yes.
Okay. So is it okay, Markia, if we just look at your folder?
Sure.
Okay, thanks. So here we are. So here are the folders currently that are in SharePoint. So we have additional reports. This is where your MIS reports will go, but not until after December 10th. Here's where you're going to upload your ASR. Personnel, that's where we just created subfolders to upload all of the documentation that's required for these 91A, 91B, 91C, 91D, 92. And then here is the policies folder. And so this is where you're going to upload all of your policy and procedures. Here is the quarterly folder. And so this is where you're going to upload your most recently completed 4 quarterly reports. And so if you can label them, you know, second quarter, third quarter, fourth quarter, that would be great. So when the reviewers are looking, they'll be able to quickly see which quarter is which. And then we have not added this folder yet, but we will be adding, I think it's just going to be a separate folder for GA5B, and that's where you'll upload that boilerplate language, what I had showed you there on the slide. And then again, under the additional reports, we have not done this yet, but we will prior to December 10th. We will have subfolders for the reports so that when you go into, when you're in SharePoint, you click on this folder and then there's going to be subfolders that you're going to know exactly where you should upload that MIS report in which folder. They're not here yet, but they will be.
Thank you.
You're welcome. Does that help to kind of clarify?
Yes.
Okay, good.
Melanie, are we gonna have to take out the data reports that we inserted into the ASR just the same way as we're not putting the ones in the quarterly report? Or are we leaving the ASR as is after feedback and input?
Leave it as is. And I think there's only, don't quote me, but I think there's only one. We ask for the first page of one report. And the reason that we did that is because that's information that HFA wants to see. So yeah, that you would just leave your ASR as is and upload the entire thing after feedback from your assigned program contract manager. Does anyone else have any other questions?
Melanie, yes, is all of that, all those folders considered, once all that document is in, right? Based on all those folders, is that our complete self-study?
Yes.
Oh, thank God. Okay.
Mm-hmm. And then
oh
yeah,
God,
and then
really
I know. And then, you know, and Corrine, correct me if I'm wrong, because this is my first accreditation cycle as well. So I started with Healthy Families in 2019. So accreditation was like the peer reviewers had already come to OCFS and all of the sites. So but I believe so you'll all upload all of the required documentation into your self-studies by that January 5th date. And then from there, once the peer reviewers choose which sites that they're going to go to, there may be additional things that those chosen sites will have to upload or modify. And that's where we will be working directly with those programs to provide that additional support. Is that right, Corrine? Like there may be additional things once your site
Absolutely, because you will want to show them the most recent data anyway. So we will be working, but it's one thing to be working with 55 programs and another to be working, you know, with 16. So that's why we're saying now just upload everything. We're going to send them that. When they decide which ones, then we'll provide, you know, special TA to those programs. And as Roxanne knows, like the last time, you know, it's a lot, but and this method of the SharePoint, I think, beats the USB that had to be sent. And, you know, for us to be looking at I think this is going to be much easier. So for all of those who have gone by, mine was the first one last time, and I was very new and knew very little. about all of this, but I remember the scramble. So I think that this time it is going to be much, much easier to provide that TA from CA.
I have another question. I know with our ASR being due in December, we've been on a 2-step process up until November, I understand. And then we're gonna have like 2 weeks to have to explain the 1-step process. There was something in the previous meeting, and I'm like, okay, so I understand for those of us, some of us will have to report on both processes, step 1 and step 1 step and 2 step.
I don't think so. We've been for, like, we're probably going to send data that does include, things before we went to 1 step, which I believe was in November of, 2022. So you might have a few reports that you're going to add here, but by the time the visit comes, that is after May, you are going to have complete 1-step information, no 2-step information to deal with by then.
Okay.
Yeah,
Okay.
and I would encourage you, if you haven't already, to just kind of take a look at the ASR. I understand you haven't started drafting it yet, but there are just a couple of places where you may be speaking briefly to when you were still doing the 2-step. Like Karine said, that ended November of 2022. The place that I really can think off the top of my head is just around your retention and acceptance analysis. Yeah. And Margaret's presentation that she gave at the SLM is embedded right in the ASR. So like for all of your convenience to be able to pull that up to look at that. And she was really prescriptive around what pieces would still be applicable for the 2-step. So you may have like more clarity once you've had a chance to go in there and kind of look at what we're asking for. And I say we, but it's us and mostly HFA.
Mira, and if you run into any sort of questions, just reach out.
Anyone else have any other questions?
Are we still being recorded?
Yes.
Oh, okay. I kind of had a staff suggestion. I guess I'll include it. One of the staff did,
do you want me to stop recording, Carol? I can.
Yeah, it's just something fun.